Professor, the Queensland decision was overturned very rapidly today. At almost 90% of the over 16 population fully vaccinated, is it logical anymore to be applying the precautionary principle at its extreme?
No, I don't think so, and I think that's what the reaction across Australia really was about, the fact that we now are living with the virus, and you might still have people who are very close contacts that you might ask to test and maybe even isolate till they get a result. But yeah, to put a whole flight in quarantine for 14 days with a variant that we think it has a shorter incubation period and it's less likely people would incubate for that long. So I think we're learning. We're going to be cautious to start, but good to see that overturned today, because I think for where we are, at this point of December, we shouldn't be looking at those heavy-handed quarantine rules.
When we talk about the rational use of the precautionary principle, though, New South Wales is ending the use of masks except on public transport and a few other settings. Given people are now used to wearing masks and given that there is this variant about which we don't have all of the information yet, wouldn't it be prudent to keep masks going a bit longer as Victoria's doing?
Yeah, Victoria's in a bit of a different situation. We've still got a fully fledged Delta outbreak in Victoria, which has different risks associated with it, particularly for the unvaccinated. What we're seeing with the rules, I think we need to have an adjusted way of thinking about that as well. It's not saying you can't wear a mask, it's saying you just don't have to. But their rules also do specifically state, they're highly recommended, strongly recommended if you can't keep your distance. And that means anywhere indoors, apart from the high risk settings they've identified, people should still think about carrying a mask and wearing a mask. And there'll be a lot of people that choose to do that. But I think that's now something that is normalised, and I think it's wise to do, particularly if you don't want the risk of actually picking up Omicron now in New South Wales and potentially being in isolation for Christmas.
The New South Wales Health Minister noted today that the state could have up to 25,000 cases by the end of January. Based on the COVID data that we've gathered over the past few years, how many of those people will have a mild illness or indeed no symptoms at all?
Well, that's the thing with Omicron. The data that came out just overnight, really, from South Africa is giving us a better picture across all age groups, not just the young people where the outbreak really started in South Africa. So it does look like it's less likely to cause severe disease. We know the vaccine still works to prevent from severe disease in quite strong. It's still not as good as it was with Delta, but it's pretty good even before you have your booster. But with the booster, the promise is that will restore that level of protection to what it has been with previous variants. So we expect those rates to be very low, and we're also hopeful that even people who aren't fully vaccinated or immunocompromised will in fact also not have quite the same risk as Delta.
Catherine Bennett, thanks very much.
Thank you.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.